Just about the best treatment I've seen as a method of treating heart disease has been EECP. It stands for Enhanced External Counterpulsation, and it's a marvelous treatment. It's completely non-invasive. There's no needles going into the body. There's no drugs being put into the body. And basically, it's the placement of inflatable cuffs. So you put them around the waist, around the thighs, and around the legs. And you blow those cuffs up with air under high pressure. And what it does is force blood up into the aorta, through the aorta, backwards into the heart, and it creates new blood vessels within the heart. So you're actually creating a new bypass, your own bypass, without doing surgery. It's a non-surgical way of creating new blood vessels in the heart, and it's a fantastic treatment. I've been working with it for about 12 years. I've treated hundreds of patients with it, and I've seen angina, which is chest pain, usually due to exertion, disappear using EECP. I've also seen it be really effective for people with congestive heart failure and for something called cardiomyopathy, which is a weakness in the heart muscle. It's a great treatment. It's synchronized with the heart cycle so that when the heart stops beating and relaxes, that's when the cuffs inflate. So you get this pressure being put onto the legs and then released, usually around 60 times every minute. It goes on for an hour. We do 35 treatments on consecutive days, except Saturdays and Sundays are off. And I've seen people not just do 35 treatments, I've seen them do 70 treatments and even more when it wasn't sufficient to create the effect. But a lot of times people will do the treatments and continue them just to maintain the benefits that they've had. So EECP is a wonderful treatment. It's been approved by the FDA. It's paid for by Medicare. It's paid for by other insurances as well. And most doctors don't use it. It's really amazing to me that people get stents put into them and they have bypass surgery done, and there was never any consideration for external counterpulsation, which to me should be used as the first resort, not the last resort. I see patients who've had everything else done to them and nothing has worked, and then they come to me and they say, nothing has worked, what do you have? And I wonder why the cardiologist or someone hasn't mentioned to them in the last few years that external counterpulsation can work for them. It works about 70% of the time. I think it would probably work 100% of the time if it was simply continued beyond those recommended 35 treatments, because I've seen people improve who were really sick and were not getting better initially after more treatments like 50 or 70 or even 100. I have a patient who is now about 65 years old, came to me 10 years ago, had a cardiomyopathy, a weak heart muscle, was told he'd probably be dead in 3 years. And at this point in time, he continues to do EECP twice a week. He's done over 150 treatments, and he has a normal ejection fraction, meaning his heart is functioning normally. It's not weak anymore, and no one's telling him anything about cashing in his chips. He's doing just great. I have a guy I saw last week I told to do EECP about 10 years ago. He's 80 years old now. He went and did EECP. I never heard from him until he came in with his wife last week and told me, I did EECP. I haven't had chest pain in 10 years. So those kinds of things we see, and we see it on a fairly regular basis. It's a wonderful treatment that everybody should know about and ask for if it isn't told to you. But we do it in the office. We do it every day, and we'd be happy to see you if that's something that you think might be of benefit, and it would be if you have heart disease. There's a treatment that's been around for about 50 years that's been used for heart disease, and it's called chelation therapy. It's very controversial. There have been a lot of sources that have said it shouldn't be used, but we've been using it. I've been working with it for over 15 years. And I've seen people with angina who got better with chelation therapy. Basically what it is an insertion of a needle in your arm, and we instill vitamins and minerals and something called EDTA, which is a chemical, ethylene diamine tetraacetic acid, that takes out heavy metals. It takes out primarily lead, but also aluminum and arsenic and cadmium, and those will be excreted in the urine. But the effect of chelation therapy is to reduce inflammation within the arterial blood vessels, and it reduces angina pectoris. So people who have chest pain, usually with exertion, but sometimes with emotion, and sometimes after eating, will have their symptoms relieved. I've had patients come to me who were told that they needed bypass surgery or stent placement and declined those treatments and came for chelation therapy, which is much more benign and quite safe, and their symptoms got better, and a lot of times their symptoms would go away. So we continue to use chelation therapy. There have been studies trying to prove whether it works or doesn't work, but basically on a day-to-day basis. I find that it works, and I recommend it to lots of patients. We have another treatment which is called Phosphatidylcholine Infusion. This is the infusion also intravenously of a fatty acid that provides healthy nutrients to the lining of the blood vessels. So phosphatidylcholine is also used for people who have angina. A lot of times we'll give chelation therapy one day and phosphatidylcholine the next, usually a series of treatments of 20 of one and 20 of the other, and then a maintenance treatment, usually done about once a month on an ongoing basis. And I've had patients come to me over the last 10 years doing these treatments whose cardiac disease is stable. And certainly if you have someone who's older and sicker and a greater risk for stents or surgery, those are the people who would benefit the most and not have the risk from doing these invasive treatments. And I should mention one word about stent therapy and bypass surgery. And studies have repeatedly shown over the last few years that those treatments in most patients do not prolong life. They don't make you live any longer than you would otherwise live. They're basically there for the treatment of symptoms. So if a person has chest pain, who can't walk down the block, who can't eat a meal without getting chest pain if the medications aren't working, those are the folks that I think should be considered for stent placement and maybe bypass surgery. But a lot of times they would benefit from chelation therapy or these other treatments that we use, and certainly from EECP treatment before initiating an invasive therapy, because those treatments are dangerous. And again, for most people, they do not prolong life.